As our understanding of medicine and treatment of illnesses has developed, we have been able to discard old superstition and improve our diagnoses. Perhaps no condition encompasses this better than female hysteria, an umbrella term for all manner of symptoms. It was a catch-all term to give explanation to symptoms as wide as headaches, yawning, difficulty swallowing, chest pains, seizures, and anxiety. Treatments for female hysteria would at one point see doctors using specialized electrical appliances to administer a hysterical paroxysm. What exactly that means we will explain later. As in today's video, we will cover what was meant by hysteria, the treatments employed, and why the condition fell out of favor. Other symptoms of hysteria would include emotional outbursts, melancholy, seizures, anxiety, fainting, or even blindness and paralysis. Some of the symptoms would include the woman experiencing erotic fantasies. The term hysteria was coined by an ancient Greek doctor named Hippocrates. The term hysteria itself derived from the Greek word hysteria, meaning uterus. Another Greek physician named Areteus would describe the uterus more closely resembling an animal within an animal. It was believed at the time that the uterus would wander around the body, putting pressure on other organs, causing all manner of symptoms. Areteus believed that the uterus was drawn to fragrant smells, and had an aversion to more unappealing smells. It was believed by Greek doctors that the difference between males and females was solely due to the uterus, and the way it would wander around the female body causing issues. Such a belief was not limited to medicine, with Aristotle seeing females as malformed and incomplete males. One other Greek doctor by the name of Cyrannus rejected this belief. He thought that the use of smelling salts in treating hysteria saw its successes in relaxing the patient, which was far more likely. By around 200 AD, the cause of hysteria started to be attributed to abstinence. Semen was seen to have healing properties, so having sex was seen to be beneficial in a number of ways. As was a common belief at the time, it was held that hysteria could be caused by the improper build-up or imbalance in body fluids. This would include a retention of menstrual blood or sexual fluids. For those who were not married, widows or nuns, midwives would be employed to perform pelvic massages to help release such fluids believed to cause hysteria. Others believed that the cause of hysteria was due to demonic possession. Women were deemed more susceptible to possession as the demons were believed to enter through the vagina. Treatments therefore included prayer and exorcisms. Some believed that hysteria was linked to the original sin, whilst symptoms of hysteria were associated with witches and the dark arts. The use of genital manipulation throughout the Middle Ages was only used as a last resort, and only to be carried out by a midwife. It would not be until the 17th century that hysteria started to be seen again as a medical problem, though this time it was seen more as a psychological problem rather than being caused by the uterus. It was therefore deemed possible that men could too contract hysteria, though this is often what we would now call PTSD, shell shock, or war neurosis. Even then, those who were diagnosed with male hysterical conditions were seen as less virile, inferior males, as well as believing that certain races of men were immune to such conditions. Nevertheless, the vast majority of people diagnosed with hysteria were women. Many reasons were put forward as to why women were deemed more susceptible to hysteria, including that they were sedentary or lazy, or according to Sigmund Freud, it was caused by sexual repression. One of the more prominent doctors who researched hysteria was Jean-Martin Charcot, a French doctor sometimes called the father of neurology. He was noted for being able to untangle at least part of the tangle of diagnoses for hysteria, realizing that some of the diagnosed were in fact suffering with epilepsy. Charcot would employ hypnosis to treat those diagnosed with hysteria, whilst pushing against the notion that men could not become hysterical. By the mid-1800s, some of the treatments for hysteria would include hydrotherapy. This treatment would involve a pelvic douche, which would send jets of water onto a woman's thighs and genitals. But one of the more prominent would be a uterine massage. As you might already imagine, this would involve placing one hand on the patient's abdomen. with the other inserted into the vagina or anus to perform the massage. In the 19th century, such treatment was standard practice. This would be carried out until a paroxysmal convulsion was reached, otherwise known as an orgasm. Doctors, sometimes with the help of assistants, would administer such treatments to women suffering with hysteria. It would not be uncommon for patients to receive regular visits from the doctor, and the doctor visiting multiple times. It is thought that vibrators were used to treat hysteria, but whether they were or not is disputed and is likely a myth. The first vibrators were hand-cranked, though soon enough they made use of the widespread adoption of electricity. In fact, the electrical vibrator would be one of the first electrical appliances to assist the often housebound woman, coming shortly after the electrical sewing machine and kettle. Whilst it would be quite clear as to the effect of the treatment, whether or not the doctors saw that they were doing something sexual is debated, though it should have been fairly obvious. It should be noted that during this time, such vibrators were used to treat all manner of medical conditions in both men and women. Often they were used to deal with muscle problems. But by the 1920s, the arrival of adult films using such devices would lead to the devices losing favour by medical practitioners. Whilst the very notion of doctors making house visits to administer orgasms to hysterical women seems ludicrous, it is important to remember the situation for many of these people. For the middle-class women commonly offered such treatment, many lived an existence with little autonomy. In the changing world of the Industrial Revolution, of advancements in science, and the opening up of the world, many found themselves trapped in their homes. It was deemed that this was the proper place for women, as they were thought unable to deal with anything else. Women were believed to be more emotional, dependent on men, and gentle by nature. They were seen as frail and more likely to contract illness. For those who strayed outside of these expected roles, it would simply be seen as a form of insanity, something to be corrected. And whilst some women may have received treatments involving vibrators, many more would end up in asylums until they were deemed suitable for release back into society, or perhaps even not at all. The pelvic massages were largely relegated to the status of alternative medicine in the 1910s. In 1952, the American Psychiatric Association's Diagnostic and Statistical Manual for Mental Disorders removed hysteria as a mental condition. This, however, did not stop its use. The condition would reappear in the 1968 edition, before finally being removed in 1980. As our understanding of mental health develops, no doubt we will refine our understanding of other various conditions. Symptoms of conditions that we would now recognize as depression, anxiety, or simply acts that made men uncomfortable would all be seen as hysteria. These illnesses would be expected for a woman living such a restricted life. It is thought that as many as 75% of the middle and upper class women in Victorian Britain were diagnosed with hysteria. Some of the symptoms displayed by women were not seen as problems in men, such as sexual desire or being strong-willed. Stereotypes like women ought to be submissive and sexually repressed were enforced by a hysteria diagnosis. Cures such as marriage and constant pregnancy only pushed this further. Hysteria is one of the many conditions that were caused by misunderstanding or malice to oppress and enforce social standards, and is a truly disturbing part of our medical history.